These aren't exercises, they're tests. And most people skip this step. So stop asking, what exercise should I do? And start asking, what does my body actually respond to? Because if exercise alone fixed chronic low back pain, you won't still be here. Hi, I'm Antony Lung, physiotherapist, nutritionist, and functional medicine practitioner. Welcome back to NxHLife, where chronic pain sufferers rise as pain warriors and learn to take back control. Today, I want to change how you use movement for chronic low back pain, not by giving you another routine, but by teaching you how to read your body instead of guessing. Because most people aren't failing at exercises, they're failing interpretations. The real problem with exercise: most people with chronic back pain already doing something. Core work, stretching, Pilates, strength training, rehab programs, and yet the pain keeps looping. Not because movement is wrong, but because movement is being applied blindly. The system teaches you to collect exercises, not to understand responses. Here's the truth most people never hear. Exercises don't heal chronic pain. Responses do. So, in acute injuries, exercises can be corrective. But in chronic low back pain, movement works best as information. That's why I don't think in terms of exercises. I think in terms of movement experiment. An experiment has a clear input, clear observation, no emotional attachment to the outcome. You're not chasing relief, you're learning your pattern. Same symptoms, different drivers, different plan. Let me ground this with real examples. Not rules, just signals. Some people notice their back pain eases when they bend forward. Others feels better when they gently extend or stand tall. That doesn't mean flexion is good or extension is bad, or vice versa. It means your system is responding to position, load, and perceived safety. Same with muscles. Sometimes stretching a tight area feels good 5 minutes, but the relief doesn't last. Whereas gentle release with trigger balls work, or gradual loading lasts longer. That tells you something important. Relief length matters more than relief speed. These patterns don't tell you what to do forever. They tell you what your nervous system is responding to right now. One key rule before we go further. If you test 2 experiments on 2 very different days, poor sleep versus good sleep, high stress versus calm, you might get completely different results. Doesn't mean the experiment failed. It means context changed. We're looking for pattern, not perfection. Let's dive deep. Experiment 1. Gentle versus slightly challenging. I want you to test the movement properly. Day A or day 1 is your gentle day. Slow movements, more supported or lying down position. Gentle stretches, smaller ranges, less effort. You're not being lazy, you're just testing safety. Day B is your slightly challenging day. Not aggressive, not pushing through pain, just a small nudge. Increase workload by about 5%, move 5% further, or add a little resistance. Then you observe how you feel during, how you feel later that day, and how you feel the next morning. Some systems calm with gentleness first, others wake up with confidence. Neither is wrong. Just recognize the pattern. Experiment 2. Range versus control. Next experiment. Does your back want freedom? Precision. Test on separate days. One session focus on range and exploration. One session focus on control and boundaries. Some backs flare with too much freedom. Arm flares with too much bracing and control. If you don't test this, you will keep bouncing between. I need to loosen up and I need to stabilize more. When the real answer is which one and when. Alright, experiment 3. Stretch versus release versus loading. Another common pattern. If stretching gives quick relief but symptoms return fast, try less stretching, more release work, or gentle loading instead. If release helps briefly but stiffen return, you may need gradual exposure, not avoidance. Again, no good or bad, just informations and patterns. Experiment 4. Speed and intention. Same movement, different intents. Try slow and cautious. confident and deliberate, or maybe playful or rhythmic. Chronic pain brains don't just track loading, they track meaning behind the load. If your movements say danger, danger, your nervous system listens to that too. Experiment 5. Recovery response. Stop judging success by how you feel immediately. Instead ask, how do I feel 6 hours later? How did I sleep? How do I wake up? Chronic pain recovery rewards consistency, not intensity. Progress often feels boring before it feels freeing. Why this matter? When you stop chasing the right exercise and start listening for patterns, you stop outsourcing your body. You stop blaming yourself and regain control. You don't need more tricks, you need math. And this is how you start drawing it. If this video resonates, I want to give you something deeper. I've created a free guide called the 7 Unspoken Truths about chronic pain. These are the truths most people only learn after years of frustration, if ever. You can download it free using the link below. And if you're ready to think differently, move differently, and stop guessing, welcome to the Pain Warrior movement. You're not broken, you're a warrior learning how your body heals. Let's turn pain into peace one step at a time. See you next time.